Across the country, rural communities are losing access to vital maternity care. It comes as more hospitals face the difficult choice of closing their OB departments.
But as Jen Thompson shows us, one local hospital is working to keep its doors open for expectant mothers in the community, despite growing challenges.
If you reduce the profit margins for some hospitals who are already very thin, then it just forces administration, forces the board to look at ways in which you can reduce costs. And maybe OB is one of the ways that you reduce costs. And in doing that, you create what's called in our industry OB deserts.
According to the March of Dimes 2024 Where You Live Matters study, over 35% of counties in the United States are considered maternity care deserts. This map from the March of Dimes shows just how widespread the problem is, highlighting areas across the country that are most affected by the absence of local maternity care. Nearly 24% of Indiana counties are maternity care deserts, and women in these areas face higher risks.
That's one of those areas that our board has always felt was really, really important to keep in our community, primarily because if you happen to deliver, we're 30 minutes from Vincennes, we're 45 minutes from Union Hospital, and you know a lot of bad things can happen in an hour and 15 minutes. That's a long time.
The consequences of these deserts can be life-threatening, especially in rural areas where every minute counts in an emergency.
I had planned to deliver at another hospital near the area. It's about a 45-minute drive away, but when it came down to the time, I was not going to make it at all.
Macy's experience highlights just how crucial it is to have local care available.
I feel like I can't really put it into words because once he was here, he did require some additional support and oxygen and things. If we had tried to make it elsewhere, first, we wouldn't have made it, and then he would have never gotten the help that he needed initially.
Despite the financial strain, Sullivan County Community Hospital remains committed to providing OB services. For them, it's more than just a service line. It's a lifeline for mothers and babies in their rural community.
It is not a profitable service line, and that's why you see a lot of hospitals choosing to close that particular service line. It just doesn't make financial sense anymore.
As rural hospitals like Sullivan County Community Hospital face mounting challenges, their decision to keep OB services open is about more than just finances. It's a matter of life and death for expectant mothers and their babies. But as more rural hospitals struggle, the fight to prevent OB deserts is becoming harder to win.
I just think that everybody should be able to have access to that if and when they need it. Just thinking about all of these things that we would have been figuring out on the road versus in a labor and delivery room with a team of nurses there, I truly just don't know what we would have done.
Reporting in Sullivan with your news now, I'm Jen Thompson.
And we reached out to the Indiana Hospital Association. Officials tell us Indiana's low Medicaid base rates leave hospitals to cover nearly $2.7 billion in unpaid health care costs every year. Officials tell us in the past 2 years, 10 birthing centers have closed in Indiana. In a statement, IHA President Scott Teitel said, IHA has been having very productive discussions with Governor Braun's administration and lawmakers about a proposal that would go a long way to protecting our remaining birthing centers like Sullivan County Community Hospital. One of the provisions of House Bill 1004 would allow Indiana to draw down much-needed federal funds at no cost to the state to boost our very low Medicaid reimbursement rates. With these additional federal dollars, we can enhance Medicaid reimbursement for hospitals, which will best enable rural birthing hospitals to improve access and health outcomes for Hoosier mothers and babies. IHA works closely with hospitals to make strides in maternal and infant care. In 2020, it launched the Inspire recognition for Indiana birthing hospitals. To be recognized, hospitals must meet criteria in several categories, such as infant sleep, breastfeeding, and perinatal substance abuse. Hospitals that meet one of those three or 1 to 3 of those areas receive the Inspire category of excellence. The Inspire Hospital of Distinction goes to hospitals that meet 4 and above. This year, Sullivan County Community Hospital recognized as a Hospital of Distinction.